Hello everybody, I am Leslie French, creator and owner of Better Balance for Life. Better Balance for Life is not all about exercise. It is about everything that we can possibly do to help ourselves be the healthiest us that we can be. So today I want to talk to you about a breathing method called the Dr. Lois Laney Breathing Method, restorative breathing. Now, there are many awesome different types of breathing methods out there. I am not saying that this one is better than any of the others, but it does serve a specific purpose. And I can talk from personal experience with this particular breathing exercise because of what it's done for me. My stress, anxiety, and triggers from past trauma, which was affecting my breathing, but I didn't realize how much it was affecting my health until I did something about it and started to notice the health benefits after following this breathing program. So take your time with it. If you want any more information, don't hesitate to reach out to me. You can contact me through my website very easily. Just press on any of the contact buttons there if you need any more information. But I'm going to take you through this specific breathing exercise. And this is something that you do need to do every day. If you want to gain the benefits of anything at all, it's something that we need to be conscious of all the time. So sit back, relax, find yourself a nice comfy spot to sit in, and I am going to take you through the Dr. Lois Laney Restorative Breathing Method. Okay, so what I'd like you to do, sit nice and relaxed, teeth apart, super important. We do not want the teeth together ever, unless you are chewing. It's the only time your teeth should be contacting each other. Every time you shut down your jaw, you are activating cranial nerve number 5. You have 12 cranial nerves. Cranial nerve number 5 is the biggest, the strongest. It then will take over. It turns down the volume on your other 11 cranial nerves. Now nothing is functioning properly. Take home key number 1, really important that you check in on yourself all day long, because I had my jaw shut. I'm a teeth grinder at night. If you shut your jaw down during the day, what are you training your body to do at night? Think about that. Interesting fact. So let's relax, teeth apart, jaw relaxed, lips together, tongue on the roof of the mouth. I put my tongue on my 2 front teeth to keep my teeth apart. If you struggle keeping your teeth apart in the beginning, get a Q-tip or a pop stick and pop it in between your teeth, yeah? That will help train you to keep your teeth apart, and you will train you where to have the tongue in a slightly different place. Super important, we only ever breathe through our nose. As soon as you start to breathe through your mouth during the day, that is signaling to you you are out of gas. You do not want to be out of gas. You want to make sure that your body is functioning properly. The less you breathe, the more oxygen you produce. I know that sounds a little loopy, but it's the way the body works. So relaxing. Remember what I said, you want to do this breathing exercise in every position that you can, laying, sitting, standing, because we can get anxious in any position. We need to make sure that we retrain the body in every position possible. So all you want to do, there's 3 minutes out of your day, just sit there quietly, inhale through the nose. And as you exhale through the nose, I want you to gently hum. And then swallow. Swallow. So inhale, exhale, hum, swallow. Now, the swallow should be natural. Don't force yourself to swallow. Wait until the body's ready to swallow. But here is a big take home for you. If you go to swallow and you have no saliva in your mouth, that is indicating to you that you are in sympathetic. Your brain is controlling you. So you need to go until you're producing saliva, because that indicates to you that you're in parasympathetic. How awesome is that? This is a tool that you can use to check in on yourself to go, how am I doing? Because guess what? Half the time we're really not quite sure, especially with all the stuff we've had going on in the last few years, and Christmas and birthdays and holidays and all the stuff that happens in life. Sometimes we lose touch with how actually am I? Here's something super, super exciting. When you nasal breathe only, you produce something called nitric oxide. Nitric oxide is one of the most important molecules in your body. So, nitric oxide is produced in the nasal passages. When you hum, because I could see some of you sitting there going, why am I humming? I feel a little silly. When you hum, you produce 15 to 20 times more nitric oxide than what you do normally. Now, nitric oxide is a vasodilator. So if you have a lung problem or you have sinus issues, that opens the blood vessels. If you have issues with your blood pressure, it will lower your blood pressure, because all of a sudden you've got more nitric oxide in the body. Your body is just going to run better. It will also promote you deep breathing through your diaphragm and not through your neck and your neck and your shoulder muscles. You've got two different sets of muscles you can utilize to breathe with. One is the diaphragm, breathing in and out, feeling that diaphragm expand and come in. And that's not a bad thing to do, is to breathe in and feel your diaphragm expand rather than breathing in and shoulders rising. Check yourself in the mirror. Are you breathing shallow and only in the top part of the lung? Or are you actually filling your diaphragm? Your lungs are big. It should push the belly out. When you breathe in, your belly should extend a little as you breathe in. Is that happening in your body? It's time for you to check in on yourself all day. So we want to do the breathing method 3 minutes. You can do it whenever you want to. It doesn't have to just be 3 minutes. So sitting there, looking at something colourful. So a pretty picture with lots of colour in it. Something that you can have a steady focus on. It is important you have your eyes open when you do this breathing exercise. You need your ocular nerve on while you do this.